Good afternoon, everyone, and thank you for joining this COVID conversation. So my name is Sarah Jane Blakemore. I'm Professor of Psychology and Cognitive Neuroscience at the University of Cambridge, and I run a lab whose research focuses on the development of the brain and behaviour in human adolescents. But today it's my great pleasure to introduce Professor Alan Stein. Alan is from the Department of Psychiatry at the University of Oxford. He runs a group whose research concerns the development of very young children and adolescents in the face of adversity. And the main aim of their work is to develop interventions to enhance children and adolescents' development and support their families. Just to give you a bit of background, Alan did medical training in Johannesburg in South Africa. He then came to Oxford to continue his training, and since then he's worked in Oxford, Cambridge and London. And in 2001, he took up the chair in child and adolescent psychiatry at the University of Oxford, where he's been ever since. Today, he's going to talk a bit for about 15 or so minutes about protecting children and adolescents' mental health, especially during this time of COVID. And after that, we'll have time for some questions. So if you have questions, please write them down and we may select them to ask Alan. So welcome, Alan, and we look forward to hearing your talk.
Thanks very much, Sarah Jane. Very kind of you to give that introduction. I'm going to begin with the words of a 7-year-old girl and what her words are actually voiced by an actress. So here they are. Oops, sorry.
I know that coronavirus means that I can't go to school and I can't play with my friends. I know it means I can't see my grandma and everyone has to wash their hands all the time. I know it makes people really sick and lots of people have died. But I don't understand why my brother is so grumpy, even though he normally hates school, and why my mum and dad are arguing, even though they think I can't hear them.
So these words and these thoughts are very typical of so many children globally at the moment. They have been given a lot of information through all sorts of channels, but particularly from their parents about COVID-19. They know a lot about it, they know quite a lot about the facts. But she has also picked up that there is something else going on in her family, which is quite a lot of turmoil, her parents struggling, and her brother rather unhappy. And what children do is they're actually excellent observers of things that go on around them, and they try to make sense of it. But as it appears, nobody has yet been able to talk to her about what is actually happening from a more social and emotional point of view. And this is entirely understandable. We are in a very difficult situation at the moment. 460,000 people have died from COVID globally, at least. The media and social media completely blankets our coverage with COVID-19. There's very little else going on. So all of us and families are highly attentive to everything, to daily death rates, daily virus rates. All of this is very permeating. At the same time, there are public health messages for everybody and for children, as this little girl said. Wash your hands, stay at home, stay safe, and save lives. So these are very clear messages for children. At the same time, families are locked down at home. They are very much there, very close at hand with each other, very little privacy, and everything they can observe about each other. So the high levels of adult stress and anxiety in the context of all this. But on top of all of that, children's routine and social infrastructure has almost entirely been suspended. There is no school at the moment. Peer interaction is really very little. Sports clubs and activities are not really available. And although these are now beginning to restart, these are critical to promoting children's mental health and resilience. So not having had this for several months is a very serious issue. But as I said, children are trying their best to make sense of this very difficult situation, and particularly of these emotional things and the turmoil in their family. Obviously, there have been changes. She noted these issues about her parents and her brother. Those are different to the way they usually were. Parents would do anything to protect their children from distress. But in this situation, children are very perceptive about what's going on. So not telling them about and sharing some of this with them and trying to understand isn't actually protecting them. They notice the changes in the world around them, and their understanding evolves through childhood and adolescence. So at different ages, they understand different things. But the information they get will need to be tailored to children's age and understanding. But what we know from the literature is that sensitive and effective communication has benefits for children and children's long-term mental health. So just to tell you just a little bit of our group, I won't go into much detail, but much of our work is focused on children in adversity. In the UK, we work mostly in Oxford. We've also worked with a number of other groups, but particularly with Blackpool, A Better Start. We also work in we also do collaborative work in a number of low middle income countries as well, and a range of areas. But the area I want to concentrate on today is the area of children in the context of life-threatening illness, which has been a big theme for us. This has been led by my two colleagues, Louise Dalton and Elizabeth Rapa, who've really done a fantastic job, and especially in putting together materials to support families in these very, very difficult times. So perhaps this was prescient of the Lancet. They commissioned us to put together a series for the Lancet about communication with children and adolescents about life-threatening conditions, and there are big, lengthy reviews about children's communication about their own life-threatening condition and communicating with children about a parental life-threatening condition. And I'll come back to more of this just now. But what we did when we put together a fairly large international group, we took a wide range of people. So our authors really included people who were working in refugee camps with children in very difficult parts of the world, all the way to people working at tertiary referral hospitals like the John Radcliffe. So we had a very broad range of people to try and reflect that. And what we did was we workshopped a set of guidelines over a long period of time and a framework to guide healthcare professionals and families to talk to children about life-threatening conditions. And that framework has actually turned out to be incredibly helpful as we go forward with the COVID in terms of creating guidelines which are adapted for the COVID situation and a range of issues around COVID. And I'll come back to some of those shortly. But I want to talk about just talking more generally to children in this context. So the key issue is that children go through different cognitive and emotional developmental stages really from very, very early on. And I just want to go through some of the kind of key bits here, which are worth knowing about. So infants really notice changes in caregivers' mood and behavior really from fairly early on. Children younger than 2 years develop what one might call a mental image of a parent or a caregiver and become distressed when they leave and seek their return. By the ages of 3 to 4, they start to understand death as a departure, part of the natural order of life. But what they don't know and what they don't understand is that if somebody dies, they won't come back to life. So it is very important to repeat the key message that the dead person will not and cannot return. Because it's quite not uncommon that, certainly in a very distressed situation, you might not want to distress a child more, and sometimes parents or caregivers will say, well, the person has gone away or they're still in hospital, try and protect the child. But we know that that does store up difficulties for the child's mental health in the longer term. I'd just like to take the liberty of reading you an email which was sent to me by a mother who very kindly gave me permission to read it out, which I think illustrates quite nicely children's difficulties, children's understanding at this stage. I was talking to my 3.5-year-old daughter about my grandma and trying to explain that she had now died. Not untypically, she asked whether she was, quote, waking up, unquote, again, even though I'd never used sleep as a euphemism for death before. And I explained to her that dying was not like sleeping and you didn't wake up. And she said, not even in the summertime. So this was a couple of months ago, which I thought was rather odd. But when we talked about it further, this was in relation to her learning about hibernation at nursery. And actually, we do have some giant African snails at home who are currently hibernating. So I think that shows how children might misunderstand and why it's important to be very clear with them. By age 5 to 6, children understand the finality and the irreversibility of death, and they understand personal mortality. But critically, they now know if you die, you won't be coming back to life. Round about the same ages, 4 to 7, there is a big change in children's emerging understanding of causality in general, and then in specifically to illness. Children develop what's known as magical thinking. Now, it doesn't mean to say that children believe in magic, but rather that their thoughts and their beliefs and maybe their actions have consequences and can affect other things in a way that adults would not. So, put very simply, we might all have an argument with somebody or say something ill about somebody else, and the next day they have an accident. We think, oh dear, how did that happen? And was that something to do with us? But we know, of course, that that's not true. But for children 4 to 7, that sort of age, they won't think that. They may well believe that what they felt, what they thought might have negative consequences. At the same time, they also develop a conscience and a sense of guilt. Starts to be an emotional a state that can occur then. So these combination of things may make children quite responsible and feeling of guilt for things that go wrong, especially around illness and death in their lives. So very important to be reassuring and to support children around that kind of thing. I just also read you a little vignette about this. I never forget the story of a little boy who I knew, whose mother had a life-threatening condition. He's now older, and he's given me permission to tell you this. One morning, he was refusing to go to school completely, even though he knew it would cause his mother, who had this serious life-threatening condition, to miss her clinic appointment. Many years later, after she had sadly died, the boy confessed that he had blamed himself for her death. "It's my fault," he said. "I was naughty that day, and I was responsible for her death. She didn't get her medication, and that's what happened. But actually, the truth of it was she just gone the next day and got her medication." So he'd felt responsible over all those years. Adolescence is the next stage. Sorry, I should say at age 9, children have a more complete understanding of death in a much more adult sense. By adolescence, age 10 to 25, there are major cognitive, social, and emotional changes. Peer influences really become the center. The importance of peers, those relationships are very important. And this is very much Sarah Jane's expertise, really a world authority on this. And adolescents can experience conflict between the needs of their family and their desire for independence, and especially in this COVID context, where they really want to desperately be out and about with their peers and need their peers, they really can struggle, and it can create a lot of difficulties for families. Sarah Jane published a very elegant piece with her colleagues, a review on the effects of social deprivation on adolescents in the Lancet Child and Adolescent Health. I think it was last week, and really worth having a look at. So what about some of the principles of communicating with children in this context? So firstly, it's important. So adults can really support children's mental health by listening and asking children what they understand. So giving children an opportunity to listen. I think it's often quite helpful if you're feeling very stressed yourself to find an opportunity when you're feeling a little less stressed. I think most adults have periods of great anxiety around this whole COVID situation. So I think try and find a kind of a calmer place to do this. Provide concrete and specific information. Keep it simple. Avoid euphemisms which can create confusion. So don't use terms like somebody has been lost or somebody has passed away, because then if someone's been lost, they could be found if we search hard enough. So those kinds of things can be confusing. Try and be authentic about your feelings. So in the case, for example, this young girl that I mentioned in the beginning, her parent, she was very aware of her parents' difficulties. So for her mother or father to say, well, no, we're absolutely fine. It's better to say, well, we're also having difficulties. We're also it's been quite anxiety-provoking for all of us. So they can understand it and then open up the conversations, and the child can see the sort of authenticity of that. And it provides a model of how to talk about difficulties. Obviously, the important thing is not to also express the most extreme of those of your feelings, but I think some acknowledgement of one's own concerns is very helpful. Normalizing common emotional and behavioral reactions to the pandemic, very helpful to explain to many people are disappointed, many of us are disappointed, and many children around the world are disappointed about not being going out to play, not being able to do this, not being able to do that, and it's quite stressful. Another important point is recognizing difficult behavior. Not all children manifest distress by being anxious or depressed, some manifested by being angry, disobedient. So I think it's being aware, especially in this situation, trying to understand that with the child. At the end, also being positive and reassuring if possible, and encourage coping behaviors, practical things that help a child focus on the moment in hand. Good for all of us, in fact, to kind of fit things, to have specific tasks rather than trying to think more generally about an unknown threat or a difficult threat out there. And then opening lines of communication then, of course, allows you to support your children with their worries instead of them having to manage by themselves. So some of this is laid out in this article, which Louise and Elizabeth led, which was published again in Lancet Child and Adolescent Health. This was in May, and they've had a follow-up article more recently, again in Lancet Child and Adolescent Health. I think that's all be available. I also just want to mention a video which we made together, Blackpool Better Start, for younger children, tips on how to talk to your child about coronavirus. That's at the bottom there. And that's all available on YouTube. So what about families affected by illness or death? As part of our Lancet series, we did a comprehensive review of the global literature, and it's large, about many, many conditions, mostly focusing actually on cancer and HIV in low middle income countries. And I think the take-home message is the quality of communication is critical for children's mental health. That's really important. The way it's done does have an impact on children's health. Effective communication is associated with better cooperation and adherence to treatment for children's illnesses. There's less anxiety, less depression, and social functioning tends to be better. But most importantly, non-disclosure at all is associated with increased emotional difficulties. As far as parental illness is concerned, one of the things that's very clear is that children are often aware even if they're not told, which is, I think, what we suggested before. Very interesting Chinese study in 2015, where over 600 families where an adult had HIV were interviewed. They interviewed the parents and the children separately. And what was clear, obviously a tricky study to do, was that only 40% of children, they were 7 to 16, were told about the parents' HIV. But of those who were not told, the other 60%, 80% were actually aware. So they had managed to pick this up one way or another by all the things that were going on at home, by their parents' behavior, etc. So parental illness, again, children's psychological behavioral outcome. We know the disclosure of illness is associated with low depression, anxiety, and poor disclosure, especially likely to be associated with difficulties. But the key bit, obviously some nuancing with some of the studies, but the key bit is that however we look at it, the time and amount of information is key. The quality is key. So just to mention very briefly, this is a study, I think the largest randomized trial done in this area. This is also done by our team, this time led by Tamsin Roshar in South Africa, with HIV positive mothers, helping them to disclose their diagnosis to their children, using lay counselors, doing home visits to a particular program. And we found substantial benefits for the families using this intervention, published in Lancet HIV and a journal called AIDS in 2017. So what about communicating about COVID-19? It's obviously a very, very difficult situation and different. For patients are alone in hospital without visitors. Healthcare professionals have few opportunities to develop relationships with relatives. And this really exacerbates the invisibility of children. Excuse me. And it's also important to be aware of a relationship, not with perhaps children and grandchildren, but a relationship between ill people and the wider family groups and different kinds of communities. These especially may be more important. Sensitive news is now conveyed by telephone, really difficult for healthcare professionals who are under enormous pressure to do this as well. And families are then in turn left to share this news with their children. Lack of time with privacy to prepare. As I was suggesting, that we developed a platform, resources, again, Elizabeth and Louise led all this, to do this step-by-step infographic and animations, including with some other colleagues in Oxford who are incredibly helpful. There's one for healthcare professionals to help them make these phone calls and go through the same kind of procedure that we described in our original Lancet papers. Then one for families to help them talk to their children about COVID, one for care home staff as well, and one for guidance for school staff. What is critical in the initial discussion with families if somebody has died is to establish what the important relationships are with children. So who are the children in the person's life? So at the end of that conversation, that's important to do that. It's lined up on the infographic on the right. And then the next step is to support, excuse me, to help families plan how to share this news with children, often with very little time. They have to do that. These materials have been cascaded by WHO, UNICEF, PAHO, and the Intensive Care National Audit and Research Centre and the Royal College of Nursing, amongst others, and translated into various languages, and is available on free on this website. Just to end, I just thought to ask you for a moment to imagine yourself into the position of someone who has just received a telephone call at home to say that their mother has died from coronavirus. Your two children are downstairs, well aware that you've just answered your phone behind closed doors. In the immediacy of your own shock and distress, you now need to walk downstairs and tell the children this life-changing news. We made these resources, excuse me, with this moment in mind, with the aim of making these seemingly impossible conversations possible. Thank you.
Thank you, Alan. That was so interesting and important. Okay, so we have 10 or 15 minutes, and there are quite a few questions coming in. So I will select a few of the questions. But first of all, I'd like to ask you on myself. So what I found in this, I mean, I've found a lot of things interesting about this whole period. But one is that children and adolescents' voices are just completely not being heard or listened to in any aspect of this crisis. We just don't hear them. And I really like the fact that you quoted some children and what they are saying. So, I mean, it doesn't seem like the policymakers are allowing children or adolescents to have a voice. So how do we, as say parents or teachers or clinicians who spend a lot of time with children or adolescents, how do we empower them to feel like they have some autonomy in this whole crisis?
It's a very difficult question, but I think a very important one. And I agree with you. You know, we're talking about opening pubs and still struggling to put enough time into working how schools and playgroups are going to be open. I think we have to support our children to write things, to support them to write letters, to communicate as they can, and to write to their teachers as much as they can, and maybe just to even, I think, to MPs, it's be a good thing to do. I would also thought it'd be very nice, I know some of this has been done, for a kind of a steering group of experts together with a child or adolescent advisory group, all done obviously socially distanced or virtually, to actually put this together, to actually take account of children's voices in all of this. Because I think we always assume what we understand children want or need, but I think asking them would be very helpful. So I think that could really be done through schools and through online platforms. So I think that'd be a very good point. No simple answer to that, but very important. I think very sad. I think policymakers are coming very late to this, and the consequences are very substantial.
I completely agree. Okay, so I'm going to select a few questions that have been sent by email or on Facebook or on YouTube. I'm going to ask you two questions because they're related. One is from Jamie, who says, how can we help our children cope with their stress? Like, for example, tantrums, arguments, tears. I mean, I guess that he's talking about younger children, but equally teenagers as well. And then Jane says, do you have any tips on the kind of words you should use in talking to children about this theme? I can see that they're two kind of related questions.
So I think, I mean, there are some very specific bit of advice about these things, but I think shortly, and there are websites which actually guide parents in more detail about using specific cognitive techniques to help them manage this. But I think the most important thing is for you to open up the dialogue with your children so they understand that you understand, to make them feel it's understandable and that their reactions are actually normal and completely understandable in the situation, and to find very specific techniques of working out how to do it. I mean, there are common techniques which I won't go into now, but sometimes some simple problem-solving techniques are quite useful. So actually, in the cool light of day, thinking with your child into the situation of what triggers them, and then thinking with them what's doing it and how you might actually deal with it before it gets too bad. So actually saying, well, how do you feel? What actually happens when you feel like this way? What are you feeling then? Okay, what could we do? And actually almost imagine yourself about to have a tantrum and what you're thinking, and then try and plan the different ways of doing it. And then what kind of diverse tactics you can do. For younger kids, things like drawing and writing, things to express yourselves in different ways is incredibly helpful. Because I think modes of expression have been shut down. Zoom and online, you're much more of an expert on the problems of online for adolescents at this point. Has become very complicated and can exacerbate things, but also necessary. So finding constructive small things to do. Don't try and do everything in one shot. There's no silver bullet as it for these things, but try and break it down to little small steps for children at home. Sorry, and the other question
Well, what kind of words should we be using?
Well, I think with young children, I think it's this issue of it. It's very, I've also struggled a bit. I think what you're going through is very understandable. It's very disappointing and difficult for all of us and for children all over the globe to do this, for your friends, and many of them are having similar difficulties. And then asking them a bit about how they're feeling and trying to talk to them about it and ask them to express it, maybe come to you or write something down. I think I would open up with those sorts of words.
Thank you, that's really useful. This question has just come in. I think it's such a key question. Margaret says, how do you cope with kind of repressed anxiety, or with a child who isn't admitting that they're anxious, or maybe not even know that they're anxious? So however much you talk to them, they say they're fine, but you have a feeling they're not underneath, and that could be any age. Margaret suggests 7, but I would equally suggest 16-year-olds sometimes find it difficult to express themselves.
So I think sometimes talking to your parents isn't always the easiest thing, whatever age it is. So I think trying to give them outlets of other people to speak to. Could they speak to friends or relatives and chat to about things? Younger children are quite good at drawing, writing things. And I think just keeping a general eye on them. It's not easy if children don't acknowledge it, but I think just keeping an eye on them. And I think trying your best to normalize feelings like that is kind of the way I think to say that this is quite understandable. We can feel very low at this point, and let them see that many other people do it. But also, I think giving them other outlets to express themselves, to see whether they would be able to do it. It's not easy, but there are quite a lot of substantial online resources, like the Emerging Minds resource, which actually gives some very specific steps to actually take if you really are concerned. And
yes, thank you. I meant to say actually that we will post, well, I say we, not me, but someone will post a list of resources and papers and further reading on the YouTube and Facebook channels. So we'll include the Emerging Minds resources. Okay, so a couple of, again, 2 more related questions. So Catherine and Jeremy both ask about evidence from previous pandemics. What do we know about children and adolescents' mental health, how it suffers or maybe not during previous pandemics or even wars? Do we know anything?
Well, we know a bit. I was thinking about that. So I think the HIV pandemic, which I think we forget because it was really much more a low middle income country, we should not, has an enormous toll on young people. It has an impact. Obviously, before the advent of antiretroviral medication meant that if children got HIV, then they died. But many families and their parents died, so many of them were orphaned. But even now, with antiretroviral medication, children often struggle with ill parents and with all the issues that's going on. So we do know that the impact is very substantial, but can be mitigated. And that the most important thing is that providing children with activities and supporting their caregivers to look after them. As far as war is concerned, I mean, the Second World War, we know, I mean, slightly more complicated. We know about children who evacuated, and what a terrible toll that took on children in many children in the longer term. So we do know it's substantial. I think the most important thing about this is that we know that it's not the same for every child. It's not invariable. There's enormous amount of difference in different children, and there's a lot that we can do to support their children and support their caregivers.
And then a couple of people have asked about returning to some kind of normality. For example, Will asks, are we likely to see problems with reintegrating adolescents, but also possibly children as well, into school in September?
Well, it's interesting. I mean, you probably know more about this than I do, but certainly I think it could be. I mean, for some kids will just be love to see, you know, we know that some gone back and love to see their peers, and that's great. I think there are some who will have difficulty. I mean, the issue of work, I mean, having missed 2 terms of almost a term and a half of work, coming back is going to be really, really difficult. Worries about your future, worries about the educational, the whole educational establishment, how things are going to work. At the moment, seem to me quite substantially confused about GCSE, A levels, all these things. What's going to happen to kids? I think that is a substantial concern. And I think teachers will have to play a very big role, and hopefully there will be clear guidance like that. And there are ways of supporting kids. So I think for some it will be okay, for others it will be quite difficult. Ironically, I think that for some children who've struggled over the years with school, being at home has actually been quite a refuge. And I know from a presentation recently about children who've had contact with social care have actually quite liked this period without the stress of going to school. I think for them it's going to be doubly difficult. So I think we'll be very dependent on social care, social workers, teachers to really help around this difficult situation. And hopefully the government will put together a more substantial framework to support schools and children more generally, because it's definitely needed. And I think the long-term costs we're looking at a very substantial issue here.
I completely agree, and I also agree that there are very big individual differences, so that you can't really generalize about all children or all teenagers. And I also, like you, have heard stories about children, for example, who are victims of bullying at school, have been relieved and happy to not have to go to what is actually a very stressful environment for them every day, and it's going to be difficult, I imagine, for them to go back. In terms of, I mean, my as you know, my lab's research mostly focuses on social behaviour and the social brain. And one element, of course, children have missed massive amounts of educational learning from not being at school, but they've also had their social interactions completely restricted. And what I find with my own teenagers and their friends is that, you know, the idea of kind of meeting up with another friend for a socially distanced walk is really not how teenagers hang out together. And so even though now they could see their friends, there's a bit of a reluctance to do that. And one thing that worries me is that 6 months with no social interaction, whether you're a child or a teenager, could be quite damaging and very difficult to come back from.
That's just another point. Just also about preschool kids, I think we shouldn't forget about them. They also need an enormous amount. Their social interactions are very important, and the kind of care and nurturing that they need is very important. So they're also having a very rough time. Their parents are having to stay at home with them. And I think we shouldn't also forget about children who are much more socioeconomically disadvantaged in terms of, say, for example, nutritional issues, that certainly in a lot of, I noticed that I was very impressed by the Marcus Rashford initiative about free school meals. But I think for young children, we need to think too, where nutrition early on is incredibly important. We've done we've just recently submitted a study which was across 5 cohorts in low middle income countries: India, Guatemala, South Africa, the Philippines, and Brazil, and 2 in Brazil, in fact, which shows really that growth and nutrition in the first couple of years of life is critical for later intelligence and schooling. So it's a slight side issue, but for many people it isn't. It's not too late, but we need to think about the health and nutrition of so many children for whom things are so much better than they were and may be reversed by all of this.
That's right. And the inequalities and how this has pushed the inequalities even further is a huge crisis, really, that's going to need urgently needs to be tackled. Yeah, and I agree about the need for play. I mean, play is so critical for development at all ages. Not, we think of little children needing to play, but play is a different form of play when you're a teenager, but you still need that level of kind of social interaction and social learning and working out where you are in your social hierarchy and having fun with your friends. And I find it really sad that, now we're gearing up for adults to go back to kind of play in pubs and restaurants, but still you see the playgrounds all boarded up and young children can't play in playgrounds. Fine if you've got a lovely big garden at home and they can play in there, but many people don't have that outdoor space. Okay, so it's 10 to 2. I think we've got time just for one more question. It's quite a big question, a really important one from Matt, who says, is there anything that can be done to address the impact COVID has had on mental health, given the demands on government funds? So I suppose he's saying, is there anything that we can do kind of locally without having to rely on more government funding to help mitigate the impacts on mental health?
Well, it's a big question. How long have I got? But I think there are some things. I mean, firstly, I think there are online resources, and many people are actually turning to online resources for this, and more there are online resources for psychological help, stuff done through Zoom and so forth. But I think the big thing is to work with the people who are going to have contact with children to help support them to manage the situation. So teachers, social care, again, that is money, but I think those are issues that are really, really important. And I think having, as I said earlier, opening the lines of communication with children so they actually are heard, they feel that their worries and thoughts are listened to and acknowledged, and that what they're observing, there's not a pretense that what they're seeing around them isn't happening, that the distress in other people is real, and that we can share things. Because once you can start supporting, once you've opened these conversations and opened the emotional conversations, you then are in a position to give children emotional support. And I think that at an individual level, I would have thought is the first thing to do.
Thank you. That was just so interesting. And I'm sure everyone was really pleased to be able to join you and hear your talk and your answers to all these interesting questions.
And so thank you, Sarah Jane. Great to have this chaired by you, and you've done a really great job. And your work in adolescence should be looked at very carefully by people as well.
And thanks everyone for joining. Bye.
Thanks very much. Bye.